Hey guys, Dr. Berg here. I have another question for you. Does your doctor look beyond symptoms? I mean, every day I hear this frustration with patients is I go to my doctor, they're not looking deeper. They just give me a pill. They're not telling me why. They're not getting to the root cause. Well, I just want to let you know, it's really not the medical doctor's fault. The whole system is dysfunctional. And medicine or healthcare has become the management of symptoms, okay? And you know it, I know it, it's just how it is. So you got this over-specialized doctors into every little thing, ear, nose, and throat, orthopedic doctors, a doctor for every part of the body, retinologists, doctors for the prostate. It's become really specialized. So there's no doctor that looks at everything, really. So here's the problem. They don't get training in nutrition. Alternative care or even nutrition is considered non-scientific. So here you are trying to do alternative stuff or natural things. You're not going to get it, okay? I'm going to show you something, and I'm not against the medical profession. I mean, listen, I completely demolished my left elbow, okay? I destroyed it. I had to go in for surgery. The doctor was a genius. He put that thing together. I mean, like I didn't think there was going to be any hope. Broke the left shoulder, the same thing. I mean, when you have technical perfection at that level of surgery, it's incredible when you need it. Emergency care, infections. What I'm talking about is chronic problems. I'm talking about the person that goes for a psychiatric problem and they're just given pills, right? They're not looking at the cause. You have clinical depression, you have anxiety, you have all this stuff, and they're just putting on pills. That's what I'm talking about. I'm talking about the person that has chronic fatigue and they're put on medication. Chronic pain, then they're put on medication. That's what I'm talking about. But I want to show you something. This is called Merck's Manual, okay, 14th edition. And I want to just show you the real problem. And this basically has to do with like plaquing in the arteries, arterial sclerosis, where the arteries become hardened. This is what it says. It says, fatty streaks probably precede plaque formation. The mechanism development remains unclear, and it goes on to show the risk factors and the signs and how to diagnose it, but there's nothing in here that relates to high insulin. There's nothing in here that relates to a vitamin C deficiency and how that affects capillary fragility or microhemorrhaging of the arteries, that then the cholesterol comes in as a band-aid. There's nothing in there that even covers the real cause. Here's one, hypertension, that's high blood pressure. There's no evidence of excessive sodium, emotional stress, or obesity causes hypertension. Well, okay, well that's cool. That's a good thing. And let me see right here. There is no cure for hypertension, but appropriate therapy can modify its course. Sedation, extra rest, prolonged vacations, telling yourself not to worry, half-hearted attempts at weight reduction and dietary sodium restriction are poor substitutes for effective anti-hypertensive drug therapy. So again, it's all about treating with drugs. There's no real causation. They don't look into, they don't even mention potassium deficiencies. They don't mention vitamin K2 or D3. This is pretty much filled with unknown cause. Here's one, vitamin E deficiencies, okay? So they're going into, and I just want to mention one thing. The vitamin E that they're recommending that you take if you're deficient is it's called a DL alpha tocopherol. That is a synthetic version. Synthetic vitamin E in large dosages over a period of time, it creates all sorts of problems. So they're recommending synthetics, and pretty much for all the vitamins right here. Again, they don't really understand nutrition. Here's one. This is obesity. The cause of obesity is simple. Consuming more calories than are expended as energy. Well, I'm glad it's simple. Again, it's not about calories. It says here, the prognosis of obesity is poor. It says the simplest way to reduce calorie intake is to go on a low-calorie diet. Wow, that's really powerful. Talk about surgery here, jaw wiring. Again, nothing about insulin, okay? Nothing about insulin or how hormones affect the calories. And you're wondering why you're frustrated with your doctor. Well, this is what they're getting. Here's another one, high cholesterol. The most effective dietary means of lowering serum, that's blood LDL, that's bad cholesterol levels, is to strict avoidance of foods containing cholesterol and saturated fats. Avoid meats, eggs, whole milk, butter, lard, and cooking fats. And substitute, when necessary, polyunsaturated oils and margarine. Yeah, okay. So right there, they're not talking about insulin again. They're just saying avoid it. Well, we know your body makes 3,000 milligrams of cholesterol every single day. 3,000. If your body makes that, then why are you going to avoid just a little bit of it? The equivalency that your body makes is equivalent to 300 strips of bacon, 14 eggs, or a pound of butter. Yeah, so your body makes it. So why is it so bad? Okay, hypoglycemia. This is low blood sugar. Okay, diabetics that are also hypoglycemic should carry candy with them. Gosh, I just can't believe this. This is crazy. So basically they're telling you eat candy if you're diabetic. Multiple sclerosis. This is an autoimmune. It says the cause is unknown. Parkinson's. Parkinson's disease itself is idiopathic. That means unknown cause. Bell's palsy. That's a problem with a virus that kind of paralyzes one side of your face and it's down like that. It says the cause is unknown. Peripheral neuropathy. That's when you have severe numbness and tingling and burning pain at the bottom of your feet or on your hands, usually from being a diabetic, right? Nothing in here, nothing talks about the real cause, which is a B vitamin deficiency that is caused by the insulin problem that's starving off the nerves, depleting the B1. If you were to take fat-soluble B1 and B12, okay, you could get rid of this, but it's not even talked about. So you're wondering, why are they not looking at the root cause? Because they're not trained, okay? So this is why right here. Faulty information. Then they're saying it's not scientific. So what I did is I created a really cool tool that can be used. It's called a symptom checker, which basically evaluates cause and effect relationships, okay? So, and you can get this if you're on my membership site or you're in a health coach training program, and it's a really cool tool. Right now there's 104 different symptoms. I'm going to create a lot more in there, but it's like a referencing. If you want to find out what's behind something or find out about something else, but I just created a little demo to show you what's inside. So check this out. Okay, so this is really cool. So it's called the symptom checker, and we have over 104 symptoms, and I keep adding more and more and more. And basically this is a tool to allow you to find the root causes of a symptom, okay? So then you can click on, let's say, tingling, burning, numbness, and it basically tells you what the cause is, B1 and B12 deficiency, because insulin, usually diabetics have this problem, insulin depletes the B vitamins, and then it tells you what to eat, tells you what nutrition to take. So you can do that with every single one. Let's take another one. Let's take clogged arteries or calcified arteries. So I go into what causes a clogged artery. It's a K2 deficiency. What to do to fix it? You have K2D3 because calcium and cholesterol build up, and then I get into what's behind that, and that's a vitamin C deficiency. Vitamin C deficiencies create capillary fragility. That's microhemorrhaging. That's little small bleeding of the capillaries, and then the body comes in with calcium and cholesterol to fix it as a Band-Aid. That's what causes it. And so here we have the diet suggestions, what to eat, what to take. And this is real quick. You can find the cause and effect relationship, PMS, rigid nails. So it's a great tool to be able to get a deeper understanding of what the heck is going on with your body. Okay, so the question is, where can I get this program? Well, we give it out as a bonus for the membership site, okay? So if you just sign up for the membership site, you get this as a bonus. Also, we give it to all the health coaches that are in training. So I have a health coach training program. Everyone in that program gets this as well as a tool. And that way, you can use it to figure out what's behind things. So if you're interested, click the link below, and we will see you on the inside.